and stroke. Endocarditis can occur when there is fungal or, more commonly, bacterial infection in the bloodstream, a condition known as septicemia or sepsis.
MS is a
Because the organisms travel through the heart, they attach themselves to the valve that sits between the brain chambers.
and optic nerve.
The oxygen and nutrient-rich
Everything we do,
environment found
whether
in
it's
both
taking
sides of the heart,
cataracts off
cataracts are rapid
simply
growth
breezes,
organisms.
relies on
Cataracts is
clumps
clouding of
known
the
as
lens in the
vegetation.
eye. It affects
To
vision
understand
particularly.
how MS
The lens is a clear
we
biconvex
must
structure
explore the disease
located
at the cellular level.
helps
In the brain, waves of nerve
Vegetations may
neural
detach from the
cataract
Clouding of the lens reduces the amount of
Each
light that
signal
reaches
is
the
a
retina,
minute but
causing
necessary
blurred
part
vision.
of intricate
Vegetations
science
are then
orchestration
The color of the
into
lens
the
also changes
where
the
they may
axis
travel
of
up
gravity
these arteries
and
of the brain,
and
causing
emotion
obstruction to blood flow and
comprise
subsequent
Cataract is
stroke.
most commonly related to aging.
Normally, the path
there are
over
many
which
other
a nerve
causes.
signal travels is protected
Cataracts
by
may
a type
develop
of
as a result
insulation
of other eye
called myelin
diseases,
sheath.
such as glaucoma.
This insulation is
Other
essential for
vision
nerve signals to reach their target. In MS, the myelin sheath
Radiation
is
such as
eroded, and
X-rays,
the underlying
ultraviolet light,
wire-like nerve
especially
line is
UVB,
also damaged.
can increase the
This
risk
leads
of
to a
developing
breakdown in
cataract.
the ability of the nerve cells to
Genetic
transmit
makeup
signals.
also plays a significant
It is
role.
believed that the loss of myelin is
Cataracts are rare in children,
attacks by
but do
immune
occur in the
cells.
form of congenital
Immune cells
cataracts,
protect the
where
body
babies
against
are born
foreign
with cataracts,
such as
develop them
bacteria
in early
and
childhood,
Zenger's
often
diverticulum
with
surgery.
MS, something goes awry.
By Dr.
Surgery
Christopher
is
Chang
the
of Faulkner
definitive
ENT
treatment.
Consultants.
Spinal.
In patients suffering from Zenger's diverticulum, there is the abnormal presence of a pouch in the throat which causes fluid and liquids to get caught during swallow. In a normal swallow study, everything clears easily down the throat, but in a patient with a Zenger's pouch, things get caught causing symptoms of phlegmy throat, food regurgitation, aspiration, and trouble swallowing. Additionally, surgical correction required an incision on the neck and pouching size, which resulted in a long
Infective endocarditis is an
However,
inflammation of the heart.
surgical advances
It can damage the valves of the heart, the heart muscle, or the lining of the heart.
to correct this problem.
It's caused by bacteria that enter the bloodstream.
Rather, the entire surgery
Many common dental procedures, such as routine teeth
After
cleaning, can
intubation,
cause minor
the
bleeding that might
device
allow
is
these bacteria to
pushed
enter your
out and
bloodstream.
pushed down into
For
the
most
throat with the
patients,
pouch.
these bacteria are harmless. But if you have a medical
Once the
history
pouch
that
is
includes a heart
visualized
birth
along with
defect,
the common wall dividing
prolapsed
it from the
valve,
normal swallow
rheumatic
tube,
fever,
a larynx probe is
endocarditis,
placed in rigid
heart
suspension.
surgery, or other problems,
Here you can
we
see
need to take
nozzle
special
lubricant
precautions to
placed
protect you.
relative to the pouch.
By prescribing an appropriate antibiotic that you take before your dental appointment, we can avoid the risks of endocarditis. If you have any drug allergies, or if you have questions or concerns about our procedures, please let us know. We want to protect you and keep your teeth healthy.
Organs such as bones,
Here, a metal rod
brain,
is in the normal swallowing
heart,
clearly illustrating the
and
common wall
reproductive organs.
separating it from the pouch.
the basic cells that
Procedures
give
are
rise
placed
to
help
all of the
stabilize
different
the common wall
cells in
in
these organs
preparation for the
are
statement
called
of
stem
procedure.
cells. One type of stem cell is an egg cell from a woman that has been fertilized by a sperm from a man.
A total of 2 sutures are placed.
This single cell, called a zygote, is the first cell in the developing human being. It's also called a totipotent stem cell because it can form any type of cell in the body, as well as the umbilical cord and placenta. After the zygote is divided a few times, it becomes an early stage embryo called a blastocyst. Embryonic stem cells come from the cells inside the blastocyst. Embryonic stem cells are proliferative. This means they can form any cell in the body, but not the cells in the umbilical cord or placenta. In the lab, embryonic stem cells are donated from leftover embryos created during in vitro fertilization. In vitro fertilization is a procedure to help a woman become pregnant.
Nothing will get trapped in
perivalvular complications,
In essence,
and
the
finally
pouch has
embolic
become a new
complications.
back
And
wall of
the
the esophagus.
trend of this
The
recommendation
patient
is
is
to
discharged
recommend
hours after
surgery,
this
but
allows
sometimes
starting
urgent surgery,
the
that
next
is,
day.
during the first week after initiation of antibiotic therapy, in the majority of the patients who have indication for surgery.
Technology involves the use of laser. In the past, we would use a blade to cut into the eye, but nowadays it's blade-based surgery, which is gentler and more precise.
And what's your vision like once that cataract is removed?
Well, your vision can be restored. You can see colors again. Vision is sharp. You can drive at night. There are many different types of lens options. You can have a standard lens option, or with a sophisticated design, you can even be freer from glasses or contact lenses, which is what I like to do.
Now tell me about your patient, Roger.
Well, Roger's kind of interesting. He lives here, and he's very typical of people with cataracts. Lives right here in San Diego. Works in the visual arts field, travels and represents artists internationally. And Roger was noticing that he was having trouble, and he was very fearful of losing his livelihood because he couldn't see. It's not only his livelihood, but it happens to be his passion. And so colors were muted, he couldn't appreciate the paintings, and he was really afraid he would lose his everyday profession.
So if you're ready to get cataract surgery done, what's the first step that you have to do to make it happen?
Well, the best path is to see a surgeon that you trust so that you can make and obtain a recommendation as to what's best for you. If you come to see me, then what we do at Clear View is thorough testing to determine your lifestyle, activities, how the cataract is interfering with them, and then what's the best type of surgery for you. So I'll make a recommendation for you whether you need surgery or not.
Well, thank you so much for coming in and sharing the information today.
Thank you for having me.
All right, that's going to do it for San Diego Made, San Diego Proud for today.
It's a condition that can strike an otherwise healthy child. Knowing the symptoms of osteomyelitis can make the treatment much more manageable. We find out more in today's Health Matters. Bacteria that not only lurks on doorknobs, keyboards, and playgrounds, it lurks in our bodies, whether we like it or not.
Everyone has a little bit of bacteria traveling around their system, and that can be caused by something as benign as brushing your teeth.
Sometimes the bacteria can travel into the bloodstream and affect the bones, a condition called osteomyelitis. Children are the most vulnerable. Pediatric orthopedic surgeon Dr. Matthew Wagner demonstrates how a child's knee can be affected.
They have leaky blood vessels. The endothelium are the cells that cover blood vessels, and they're not as tight, making this transient bacteria that's in all of our systems
This animation
a
will
little bit
show
more
how
likely
surgery
to
is
exit
used to
in these
correct a
areas.
cataract.
The knee,
This operation
being a
is
skeletally
called
immature patient, is
phacoemulsification
affected
cataract
with
surgery.
50% spontaneous acute
Click the navigation
hematogenous
arrows
spread
below the animation
constitutitis.
screen.
As
to
Dr.
play,
Wagner
pause,
explains, the
rewind,
bacteria
or
can
fast
spread
forward the
dramatically.
animation.
Once it has established itself within the bone itself actually has a network
Here we show the
of
different
what's called
parts of the
divergent
eye.
canals that allows cells within the bone
A cataract is
to
caused by
communicate with each
changes
other.
in the lens
bacteria
protein
can
of your
then
eye.
use that to communicate.
It
That's
usually
when
develops
children
over a
start
long
to show
period of time.
symptoms.
It's probably one of the most
Most often
common
a cataract is due
in
to the
extremity.
aging process.
Limp, especially in young children
Once
where
your
they can't tell
ophthalmic
you
surgeon has
how
examined
much it
you,
hurts here.
drops will be placed in
You'll
your
see
eye
them
to dilate
favoring
or
one leg.
widen your pupil.
Certainly there can be swelling, there can
This
be
makes it
redness
easy
over
for
the
the
area,
surgeon to see the
fever.
lens of your
Those are
eye.
some of the more common.
Local anesthetic
Symptoms
drops will
should
be
not
placed
be
in your
ignored.
eye.
Osteomyelitis can
completely
be
numb.
treated with antibiotics. For
Sometimes
those
a
with more
local
severe
anesthetic
cases,
injection is used
surgery
instead
may be
of
in order.
drops. A tiny cut
I'm
is
John
made on the
LaFarge.
surface of your
Infants
eye.
can also be affected.
The cut or
Infection
opening
can
is
spread
usually
to
so
the
small
joint and
that
cause
no stitches are
arthritis.
needed after the operation.
Diagnosis. The initial diagnostic es base on clinical suspicion. Leukocytes and impresión de eye. Cultures of bone. Point fluid and blood cells are household. The imaging study included radiography, scintigraphy, and in some cases, ultrasounds of the MRI.
this video, you're going to learn about osteomyelitis and how it's treated. Osteomyelitis is a type of bone infection caused by bacteria that can affect almost anyone. Children who become infected usually have their long bones affected, particularly the bones in their legs. Adults typically see infection in their vertebrae and hips. Since almost anyone can become infected, it is important to understand what some of the risk factors are. Contributing risk factors for osteomyelitis include circulatory problems, including diabetes, artery disease, and sickle cell disease. Recent injury, like bone fractures and punctured wounds. Use of street drugs, non-sterile needles creating puncture wounds near the bone. Osteomyelitis can cause quite a few secondary complications. In children, osteomyelitis can damage the growth plates, which can lead to impairment in growth. Occasionally, the infection can move to the other joints, causing septic arthritis. In the worst cases, the infection can cause the bone to die due to a decrease in blood supply to the bone. Treating osteomyelitis can be a long process. Orthopedic physicians may suggest starting with a bone biopsy to help choose the best antibiotic to treat the particular infection. Antibiotic treatments usually last around 6 weeks and are administered through an IV. Many cases of osteomyelitis require surgery. Surgery may be done for a variety of reasons, including draining the infection, removing infected bone, getting blood back into the bone, or, in the worst case, amputation. If you are experiencing bone pain, a fever, and swelling, it is imperative to see an orthopedic specialist. The physicians at the Illinois Bone and Joint Institute are some of the best orthopedic doctors in the Midwest. Their experience and training in treating all types of orthopedic conditions, including osteomyelitis, make them your best choice for orthopedic care.
Tratamiento. Antimicrobial therapy shall be instituted and how caso. The effects body and spirit for culture shall be undertaken until the blood culturing is positive. Incision and drainage shall be actually made within their supragnostic access. Antibiotics with proven efficacy against Staphylococcus aureus include anti-staphylococcal, penicillin, clindamycin, third generation, cephalosporin, and vancomycin. Conclusion: depending on the early diagnostic and treatment, mortality is low and complication rates approximately 5% because of the various course of the disease is recommended. The treatment is individual for each case. Antimicrobial therapy shall be institutional in all cases. The effect on spirit for culture shall be anticipated while the blood culture is positive.